What legislation would you propose to, in the state of Texas, to either defeat Obamacare, reduce the negative impacts of it, or to provide alternatives for means of delivering health care in the state of Texas? So Matt, you'll get an additional minute to kind of follow up on that, but Glenn, we'll go back to you and let you answer that.
The ACA is a federal program, and so as much as we want to say we don't like it, we don't want it, it's the feds that are forcing it on us. I was so happy to see that the Texas Legislature and led by the governor refused to expand the Medicaid rolls in Texas, because that would have been a permanent expansion of a number of people without necessarily the funding to take care of that. That said, Texas has the highest uninsured rate in the nation, and they show up in our emergency rooms like Baylor Plano, like THR, Presby Plano, like Medical Center of Plano, and that's the most costly, least effective way to treat those folks. Meanwhile, the federal government is keeping $5 billion of our tax dollars because we refuse to play their game. And so one of the proposals is to really push the federal government to give us the block grants so we can have access to our tax dollars that we've paid, so we can take care of the people that are presenting themselves with the medical issues and trying to provide wellness care and not just sick care. One of the programs that Baylor has done down in the Dallas area is the Juanita J. Kraft Diabetes and Wellness Center. Diabetes is a chronic disease that creates all sorts of complications that are very costly to treat. By providing this wellness center, training center in a blighted area of Dallas, Baylor has seen a dramatic decrease in the number of people presenting in their emergency room with those complications of diabetes, and as a result has really cut the cost that they've had to deliver that sort of indigent care. I agree with Matt. I think providing indigent care is something that our healthcare institutions and doctors feel very good about doing, but there's not enough of that to be able to care for all the needs that we have out there, and so we've got to have a more comprehensive approach, and having these kind of block grants would allow us to do that.
Well, really, it's just, practicing our 10th Amendment right. Alabama was, I believe, the first state who nullify Obamacare, basically saying that any federal agency or person working for the federal government who tried to come into their state to implement it would actually be breaking state law, and I think that's definitely something that Texas, we can follow suit. I'm actually surprised we weren't, the first ones to do that. But really, it's about getting government out of the healthcare industry. There's been a few doctors in other states who have decided that they're not even going to accept healthcare insurance anymore. They're just it's basically going to be that the patient comes in, they're going to pay what it costs to, for the doctor to see them, and that's it. You don't have to fill out any forms, you don't have to, pay a deductible, things like that, and go through all that difficult process just to, for some, just to go and see the doctor for a simple checkup. So, really it's just about getting government out of healthcare.
We need to look at ways to phase out the federal government's involvement instead of expand it. And I talked about Project Access. Project Access has actually addressed some of the issues with respect to the indigent going straight to the emergency room. What Project Access does is they establish a relationship with their doctor, the general practitioner. Then if it's discovered that they need specialization, those types of stuff, those types of things, we have specialists that are in the Project Access partnership as well. We actually have excess capacity with Project Access in Collin County. So I think it does tackle the indigent health care need in Collin County. Now, not every county in the state of Texas is like Collin. They're not all blessed like we are. That's why I want to empower county commissioners' courts the power to provide incentives to doctors. So like if you look at the border counties and some of the other poorer counties, that there's an economic incentive for these doctors. But I got to tell you, quite frankly, I'm not sure they would need that. I think just they want to give back to the community and give, return to the community and help those that are in need. I think that's why they're doctors to begin with.